It brings me great joy to be here today. For those of you who are joining Health for Nigeria for the first time, I can give you just a very short background. As Mr. Olumide mentioned, my name is Professor Abimbala Akintade, and I'm the founder for Health for Nigeria. The mission for Health for Nigeria is to increase access to all Nigerians despite their socioeconomic status or geographic location. We actually started this nonprofit organization to help educate healthcare leaders in making decisions that would positively impact our people. And during the pandemic, we've made a slight shift in terms of our focus. So right now, our flagship program is the Nurses School program. And what we do with the Nurses School program is we partner with rural public secondary schools in Nigeria. And also with the state and local governments. Partnering with these schools provides us with the opportunity to acquire just some space, any space we can get in the schools. We renovate the schools, and sometimes the renovation includes painting of walls, repairing of ceilings, tiling of floors, installation of doors and storage spaces. And then we equip these spaces with healthcare, equipment and furniture, and we turn these spaces into clinics. We hire registered nurses into these spaces, and the registered nurses have 5 objectives. One is to care for the students and the teachers and staff in these spaces. 2, COVID-19 education, because we know we're still experiencing some of COVID-19. 3, we've actually created health clubs in these schools to help educate the children in terms of health promotion, disease prevention. 4, we partner with parents of children who have chronic healthcare challenges. We educate the parents and the guardians. And 5, we do outreach programs. So far, Health for Nigeria has 10 clinics across the country. We have 3 in Oyo State. We have 3 in Ondo, we have 2 in Ekiti, 1 in Abuja, and we're actually, we have 1 in Osun State. We're currently putting 1 together in Delta State, and we believe we'll do 1 more before the end of this year for a total of 12 clinics. We've seen over 15,000 children for free. We've conducted outreach programs that have impacted the lives of probably over 5,000 individuals in the community. So we're really excited for this international work that's impacting the lives of not only children but adults in Nigeria. So that's a background on Health for Nigeria. Without further ado, I would like to introduce you to our speaker today. She'll be talking to us about the importance of disaster preparedness and management as we're transitioning from COVID-19 to monkeypox. So our speaker today is none other than Dr. Oluremi Adejumo. Dr. Adejumo spent her entire professional tenure working to promote equitable access to preventive health care services in the United States and abroad. Integration of evidence-based preventive care is vital to individuals in substance abuse treatment, considering their ongoing physical and socioeconomic issues, leading to shorter lifespan of the marginalized populations. She believes that knowledge sharing best practices can enhance health promotion and help bridge the gaps in prevention. Thus, moving from the silos, she participates in interdisciplinary, evidence-based preventive health care practices to promote quality health outcomes. Dr. Adejumo has almost 30 years of experience in leadership, management, and nursing education combined. She believes that effective collaboration and leadership can impact stakeholders, which include patients, organizations, systems, staff, and so on. A prudent nurse should assess their underlying beliefs and values, should be committed to continuing lifelong education, should engage stakeholders, and demonstrate creative, evidence-based strategies to improve outcomes. She facilitated the International Nurses Society on Addiction in Nigeria, the first country chapter on this continent of Africa. She has enthusiastically contributed to and engaged with international NSA at the US and global levels. With her specialty knowledge in disaster management and emergency health services, she also developed the first disaster nursing program at the University of Maryland School of Nursing for the undergraduate nursing students. Please join me in welcoming Dr. Oluremi Adejumo.
Thank you, Dr. Professor Untitled, for the warm welcome. Thank you so much for coming, everyone. So we have a very short time, so we'll just go right ahead and zoom into the reason why we're here today. Importance of disaster preparedness and management, thinking about the perspective of COVID-19 and then our current monkeypox. We have 7 objectives to look at, and so the first one of the objectives is, for this presentation, you will learn about international impact of COVID-19 and monkeypox. Encourage the culture. This will allow us to think about encouraging the culture of disaster preparedness, institutionalization of disaster management, safety and quick decision-making in disaster management perspective. Then we'll also be able to learn about, what do we do? What do nurses do with post-disaster medical help and first aid? Risk of disasters caused by human errors. And the last one, the role of nurses in disaster management cycle. I just would like to first provide you with this disclosure. There's no conflict of interest, and my personal view or this presentation, what I have written in this presentation does not necessarily reflect the official policy of University of Maryland, nor the position of Health for Nigeria. So before we zoom into the objectives, I would first like for us to go into the background of the different disasters and that we've had both in Nigeria and in the global arena. It will enable us to understand what goes on and what our current state are, the current state of management and how we can actually influence a better policy development. So this is for everyone on this platform right now. I just would like for you to just imagine pre-COVID pandemic. Just imagine that you are in your office, maybe at the School of Nursing, or you are somewhere having a joyful time. And all of a sudden, you heard an alert that says, oh, everybody have to evacuate the wherever area you were, and there's a pandemic, and there's a necessary need for emergency evacuation. You have to leave your house right now, and you can't stay there in the area. How would you respond? And just imagine we have a lot of nurses on this platform right now. How would nurses respond? So I would just like to see your responses in the chat box, if you don't mind. And then I have somebody, so kind of, because this is real for every one of us. How would you respond? Can somebody read the responses to me, because I can't see the chat box with this.
No response yet in the chat box.
Oh, no response yet.
Yes.
This is supposed to be interactive.
Dr. Adejumo, I actually put in a chat in the chat box, and
okay, I see.
With what you're saying, I remember this happened to me. I had just become an associate dean at University of Maryland, and I just moved into my office. I was really excited about my office at the time, and 2 weeks later, we received an email that said we needed to grab all our belongings and we needed to leave the building, and we weren't sure when we would come back. Many of us thought that we would be back in maybe a week or two. I did not see my office again for 2 years.
And imagine, thank you so much for sharing that. You are not alone at the time. So many people left their homes. At the time, the emotions, a lot of people, when it comes to disasters or when it comes to kind of pandemics or hazardous events, there are so many negative emotions, and it's not just because of COVID pandemic. It's been an existing problems all over, not just Nigeria, not just the US, all over the globe. Disaster, when we think about it, it creates anxiety in human hearts, because the problem is I can't really predict what my tomorrow will be if I'm evacuated from my house, or I'm asked to leave my office or my job, or where am I going to stay? Those are the things that people actually face when they have to kind of evacuate or be displaced from their normal or normality due to disaster events. And there was a Gallup poll in right before 2020, and then it's been like annual. If you can you see this screen right here? In 2006, the negative experience index of the worldwide, for people worldwide, was high. When you compound this on the events of COVID and monkeypox and flood that people will experience in their lifetime, in their nations, in their communities, it's even worse. In 2020, if you look at the 24 to 32, it's not much different. So what this tells me is that problems with negative experience when it comes to disaster events or when it comes to pandemic is been an existing issue. It's not new due to COVID, and it's not new, something that has never been resolved. As we know, prior to COVID, we've had monkeypox before in Nigeria, and since 2017, we've had different MERS, SARS, think about it, in different nations of the world. All these disasters, they threaten many lives and properties, and especially when you include flooding into it. It is important for us to increase public awareness and education, but is that really what we have right now? The goal for increasing public awareness and education is usually to reduce mortality, because if I'm aware of it, if I'm aware of my exposure to monkeypox and how monkeypox or COVID can be easily transmitted, I will take better precautions of it for myself. But is that what we have in different nations? Is that what we have in the globe? Right? So we have to also think about the pre-disaster community preparation. Currently, we can actually say it's in shambles. And this is reflected by or contributory of the inequality in healthcare services that we have all over the world, especially in Nigeria. When there's no work, when there's no employment, how can people afford to pay services that preventable services? And on top of preventable services, if that's not, if they cannot prevent certain chronic diseases, they have significant predisposition to the disaster and its effect or its complexity on human lives. So ineffective disaster plans also is the problem that it's all across the national levels. So poor preparedness does not only transcend only to Nigerian countries, Nigerian states, it's all over the boundaries. So that's the reason why monkeypox started from the Central and Western Africa. It's now in the US. And as a matter of fact, I'm going to show you in my few other slides that the number of exposures or cases in the US is even on in the global aspect or arenas, they are more than the rate that we have in Nigeria or the Central Africa. So what COVID-19 revealed to us is that the existing health issues that we've had in the past, that we're still experiencing right now, is the key to vulnerabilities. If we don't fix those, anytime we have emerging, and it's inevitable, we will have emerging pandemics, epidemics. What are we supposed to do with it? What will be the next one? How do we prepare for it? Should we just ignore and pretend nothing happened? Or should we just pretend as if there were no deaths? right? As you can see from this slide, we have earthquakes. We've had stories about different countries that are dealing with earthquakes. We've had stories about different countries that are dealing with flood, even Nigeria. In many states in Nigeria last week, we had flooding issues, flooding complaints. Many people were displaced from their houses. Many injuries, many destructions to cars. We've had storms. We've had extreme temperatures like in Arizona and California, fire issues. So we're dealing with many episodes or many events around disasters. Now, when we're thinking about floods, COVID, as we have right now, if you're in Nigeria or you're in other places that are dealing with floods, and we are discussing about monkeypox, sometimes I will remind you, what is the next step? Or what should we think next? Or what should we expect next? But as we are, as we're discussing or thinking or reflecting on our inactivities or what we as nurses or even medical personnel have not done, that we could have done to improve lives, to improve properties, and to improve humanity's social living, we should also think of how we can improve this to develop better policies so that we can improve health outcomes. So this brings me to my first objective, the impact of COVID-19 and monkeypox. We're still dealing or juggling with the floods and two pandemics concurrently, simultaneously. In the early 2020s, like we discussed about earlier, we heard about COVID-19. Prior to that, we've had so many. Now we have monkeypox. As you can see, they are all from different origin. The COVID-19 originated from Wuhan, China. The monkeypox originated from Nigeria. As a matter of fact, when I was looking at the map of monkeypox from Nigeria to so many countries, it was a lot. And sometimes I wonder what happened. That was it that people were not screened properly before they traveled, or what could possibly be happening? In the COVID, if you look at the cumulative cases of monkeypox in the globe right now, we have 64,000, right? In the non-endemic area, which includes Nigeria and the Central African of Congo and other countries in the Western African nations, right? The cases that we have there, in those cases are kind of lower compared to what we have all over the globe. Could you also, sometimes when I think about this, I'm thinking about, do we have appropriate screening? Because how could the endemic area have lesser number or lesser death compared to when it's spread out? Could it also be that, misdiagnosis? Because when you look at it right now, we have, right now for COVID, we have like 27 clades, which is kind of the mutations. We have, right now, we only have 2 from the monkeypox. And the rate of transmission of both are different, but the symptoms are about similar. Could it be misdiagnosis that is making this number less? If you look at the symptoms for COVID and monkeypox, they're about the similar, they both have fever, but the only difference is monkeypox have lymphadenopathy, where inflammation of the lymph nodes, whereas the COVID-19, once you've already been exposed and already have the symptoms been developed and you're showing symptoms, you do have like loss of taste or loss of smell, but not everybody have that symptoms. So could it possibly be that we have misdiagnosis, right? And how could we prevent this event of this symptoms of monkeypox or COVID being spread around? We all have a part to play in this. And this brings us back to what we were discussing about, So many places in Nigeria, have poor infrastructures when it comes to disaster management. And also when it comes to pandemics, even though I'm too serious, they've done it. I was looking at the extent of what the CDC and CDC in Nigeria have done when it comes to the COVID-19 and it comes to Ebola. I can all but give them kudos. But we still have ineffective coordination that could be improved. Ineffective civil protection agencies are not, the civil protective agencies are not being inclusive, included in the care of preparedness. Because when we have preparedness, when we're discussing about preparedness, how many times do we have drills? We can't prepare for something that we would actually have not simulated events. So now we're also thinking about the burden of disasters as it comes to the nations, from one nation to the other. We learned that the burden of disasters is not just in the boundary of one nation, it transcends across the globe. When we have increasing intersection of morbidity and mortality, what can we do to improve such? Then the other thing we want to learn from this is that when we have too many compounding factors from pandemics, MERS, SARS, we have monkeypox. Is it possible that we just get stressed out and we just give up? What can we do? If it doesn't concern us, doesn't mean we can help. So many nations are still, despite what we have in the place right now at the state of global health situation when it comes to the health perspective, many countries are still not prepared appropriately. So that brings us to President Obama's warning. I believe it was right after one hurricane while he was in president. So can somebody share this, I think, play the video for me, please. We can hear it. Anyway, I can't hear you. Can you hear me?
Ruth, can you start it again and increase your volume?
Investment for us to make. Devastating effect in West Africa, but it is not airborne in its transmission. There may and likely will come a time in which we have both an airborne disease that is deadly. And in order for us to deal with that effectively, we have to put in place an infrastructure, not just here at home, but globally, that allows us to see it quickly, isolate it quickly, respond to it quickly. And it also requires us to continue the same path of basic research that is being done here at the NIH, that Nancy is a great example of, so that if and when a new strain of flu, like the Spanish flu, crops up, 5 years from now or a decade from now, we've made the investment. And we're further along to be able to catch it. It is a smart investment for us to make.
Thank you.
All right.
Thank you. So as you can see, President Obama predicted this probably about 7 years ago or more. Still, 7 years to now, or even longer to now, we still have problems. What is it that we could improve based on what we have right now? We cannot continue.
Adejumo, can you please share your slides again, please?
Oh, okay. Can you see my screen now?
We can't see your slides.
Oh, you can see my slide. Okay.
So share screen at the bottom and then click on your slides.
Yeah, I can't find the share screen.
If you put your cursor at the bottom, it should highlight it, and it's a green icon. It says share screen.
Oh yeah, I have to log out. Okay. Yeah, can you see my screen now?
Yes.
Okay. Sorry about that.
Can you go to full screen?
Yeah. So that brings us to the second objective. Right before the second objective, even Bill Gates discussed about we're going to have many more pandemics. How can we prevent it? This was before we had the spread of monkeypox all over the world. So objective 2, we need to start to think about culture of disaster preparedness. When we work in silos, we can't get our work done. It's not about competition. It's about how to save lives and how to improve health outcomes, the health outcomes of people that are exposed or most likely will be exposed to the events of pandemics or epidemics or even hazardous events. So the way we can start this process is to think back. We cannot start the process without reflecting on our inactivities in the past and using that to develop a better approach for the future. So we need a course correction. A course correction will bring us back to developing resilience in disaster, like a resilient disaster societies. This will enable us to provide equitable access to quality and affordable healthcare services. It will enable us to be able to manage any capacity of emerging disaster issues or events that are coming, and will prepare us to be placed at a good or better position of readiness for any disaster events. It will also enable us to start to think of how to develop effective infrastructure. It will enable us to maintain a system level coordination, and it's not just for the Nigeria, it's for all over the globe. As we do this, right, the integration of emergency response will be better because we're developing plans to make a better prepared country or prepared nation. There's so many efforts in the global arena about institutionalizing disaster management. I'll start from the local, which is the national for Nigeria perspective. This is from a presentation that was delivered by the Nigerian Center for Disease Control. As you can see on this slide, the task force for any emergent need starts from the presidential task force. And then it trickles down to the Federal Ministry of Health, then trickles down to the national or the Nigerian Center for Disease Control. If we have somebody at the presidential level that possibly doesn't, or maybe the task force are not effective, remember now the ineffectiveness will be translated down and trickle down to the other aspects. So this makes me wonder what happened in the event of Ebola. Nigeria was one of the, demonstrated, its NCDC demonstrated a good working effort during that time because they were able to contain compared to other nations. So fragmentation or inorganization will always impede institutionalization. So when we have fragmented care, and the fragmentation comes from the fact that we are working in silos. Nurses are doing something different, medical doctors are doing something different. We have to come together to work together. Then the other thing is bilateral and multilateral cooperation is required because it can foster regional collaborations, and then the institutionalization will work in that effect. So still going back to the global disaster efforts that we discussed earlier, the last one was the Sendai Framework for Disaster Reduction. They've had so many. Since 1989, they've been meeting and discussing, but you know what, since 1989, we up until 2022, we still cannot get it together. Sometimes I wonder what will happen in the next 10, 20 years from now. We've had so many efforts to build resilience across the globe, but you know, that effort doesn't work. It has not worked. So the Nigerian aspect for the decision making, which really enabled the effort with COVID-19 to work, when they noticed or they were informed about the global effect of COVID-19 in December 31st of 2021, so many actions or activities were put in place. The NCDC established a coronavirus preparedness group immediately, and up until 2020, in March 2020, the effort of campaign regarding the campaign for vaccination were put in place. In the next slide, you will see that the spike, even though they had some spikes, which almost all countries had around this time, but it started to go down within the short period in Nigeria. And then what did Nigeria do to enforce or to promote the effect of preparedness that they have really established during the COVID-19 effect pandemic? There are so many activities that were done. Early detection and confirmation of cases. They maintained capacity to effectively manage the cases. They had like 5 hospitals that were initially 5 hospitals in Nigeria, which was what they were using before to test and to diagnose, or the laboratories that they use. And then within a very short period of time, that number from 5 increased to 37. I could not even imagine, that was what Nigeria did. So they had a safety plan, and then there was a quick decision to make the labs available in all the states in Nigeria. So from 5, which you can see here, to all different states, they have the molecular laboratory network plans that, if you have COVID in one state, you don't have to travel to Abuja, which was what was pre the pandemic, and compared to what it is right now. So that's really good. And this effect, as you can see, wouldn't have happened if there was no collaboration. So post-disaster medical care, when we're thinking about post-disaster medical care, it's not just about the disaster itself. It's about what we discussed about what are the medical issues that will possibly predispose any person or community to disaster or to disaster effects. We all can have the pandemic experience, but the effect or the impact on every single person will be different depending on our prior or pre-pandemic predispositions. So disaster medical care, I just also would like for us to think about, what will happen when a person or a community, entire community is displaced. We have another scenario here where there was a hurricane, I just named it Hurricane Romeo. 260,000 people were displaced. And these people include adults, pregnant women, adolescents, children, infants. and that they were displaced in just like a shelter altogether. We can imagine what will be the effect of this displacement of this many people, and that they are in one little shelter altogether, breathing upon each other. What kind of medical care do we think we can provide? So the medical services will include nursing services and the medical services combined together. It will include psychiatrists, it will include psychologists, it will include dietitian, it will include just the emergency responders too, combined together. It's not just a silos event. It will also include for us to continue to deal with the chronic disease management that patient had. If a patient is on ventilator and they have to displace the patient, are you going to take them off the ventilators? If they are on medication for psychiatric medication or psychiatric events or conditions, what can we do with those medical emergencies plus displacement that they have? It will also include, brings us back to thinking of tertiary prevention at this point too. Remember now, this much people, 260,000 people were displaced to a shelter. We'll be worried about communicable diseases like diarrhea, diarrheic events. We'll also be worried about primary and other primary and secondary prevention so that we can provide routine health care screening. We still continue to provide immunization that are needed by the neonates, that are needed by the infants and adolescents. At this point in time, we may also think about putting nutritional counseling into the disaster preparedness, well-child health care, prenatal and postnatal care. Remember now, we discussed about having pregnant women among the 260 people that were displaced. Then most of all, we have to think about preventing communicable diseases, right? So objective 6, disaster, also we are the problem of most of the disasters that we have in the world right now. Some of the disasters are human cost. We have technological disaster like airplanes, wind terrorism. We have oil spills in Port Harcourt due to some carelessness. We had some nuclear accidents in the past from Japan when 2 of the employees were not trained appropriately. We've had derailments, train derailment. These are going to be ongoing in our world today. Terrorist act, building collapse, mass shooting, and then on top of that, we have the epidemics and we have the floods. So disaster management circle is something that we all have to figure out where we should be responsible. When the disaster happens, it's not the time for the preventive actions. The preventative actions actually start from before the disaster occurs. If we wait until it happens, we'll have a lot of death. As you can see, before the event is the green line, and after the event is the yellow line. We cannot start preparation after disaster, everybody will die. So it is important for us to know, your capability if you reflect on what your talents are, or what your gifts are, or what your education levels are. That doesn't stop us from actually volunteering in our civil agencies where they need help. And it doesn't also stop the local health departments or the national health departments from performing drills. Our first drill of disaster preparedness cannot be at the disaster itself. It has to be performed, well prepared, well equipped before the disaster occurs. So disaster management circle, as we see, based on what the circle we just went over, it involves mitigation. And the mitigation itself is just to minimize the effect of the future. Remember now, the future disasters. The preparation occurs based on what we have seen prior to the disasters. The response itself is the actual disaster state By the time we get to level 3, phase 3, we must have had our infrastructure in the right place, the right people, with appropriate drills. And it's just not one episode of drills. The drills at schools, at the colleges, the drills at the nursing facilities, and even the workplace drill, workplaces, at workplaces. The recovery event is what begins at the end of the disaster. We want to come back as we are right now. We are under the recovery state from COVID. I'm not sure about whether we are undergoing recovery for monkeypox yet, but there are a lot of businesses are coming back, back to normality from the COVID pandemics. Then the last of all, the responses, when we think about this, right, we cannot think of having disaster preparedness when the disaster itself is underway or undergoing. So this brings us to the references and the end of my presentation today. As we are all here, I want us to think about how we can influence change in areas where we all are working. We all have a part to play. Rome is not developed in one day. It takes practices, it takes effort, and it takes dedications. At the end of this slide, I want us to think about that natural or man-made disaster, it presents severe threats to humanity. All countries are prone to disaster events. They can transit from one country to the other, and we as healthcare professionals can reduce the mortality events associated with every pandemics, every epidemics, or even any hazardous events. Several activities must be executed before, during, and after disaster events. Nurses also are encouraged to be collaborators with medical doctors, with laboratory technologists, with psychiatrists, with psychologists, dietitians. We cannot work in silos. It's not about my degree. It's not about my level of understanding. Even people with the housekeeping, we all have to be inclusive in the care that we develop. Every single person must take an active part in disaster management. So this brings me back to this quote from Joanna Goffey: knowing is not enough, we must supply. Willing is not enough, we must do. Thank you so much. At the end of this slide, I would like to have a special thanks to my collaborator. I call him a brother, Dr. John Oladejo from the NCDC Nigeria. He was one of the forefront here of Ebola, COVID-19, and the monkeypox that we have right now. So thank you, Dr. Oladejo, because he's been a contributor to all my activities, and he's also a contributor to these presentations that I'm giving to you right now. So thank you. I'm not sure if he's here, but I just want us to give him a kudos. That's the end, and thank you for all for coming today. Thanks. That's it.
I'm very much with you.
Oh, you're here. Oh, Dr. Ola, thank you.
I listened to your lecture.
Thank you so much, sir.
All right, so wonderful. Thank you so much, Dr. Adejumo. We really enjoyed your lecture, and we'll have actually some time for questions and answers. So for everyone here, if you have a question, please type it in the chat box. Let me also take this opportunity to appreciate Dr. Oladejo. I've heard a lot about you. I hear you are a clinician and an academician, and there's an opportunity to write a book that addresses disaster preparedness and management in Nigeria. We need people like you who can help us educate all of us in Nigeria. So when these events happen, we can have the necessary information. I also want to Yes, thank you. I also want to acknowledge some of our collaborators. I know some of the HFN board members are here. We appreciate you. Our other clinicians, our professors, our physician colleagues who are also here. We really thank you and appreciate you for your time. Health for Nigeria is purely sponsored, by individuals like us here on this call. So I see some of our sponsors, Mrs. Bumiola Tunji, we thank you for being here. Dr. Oluremi Adejumo, I have a question for you.
Sure.
So in Nigeria or countries in Africa where we are very religious and almost to a fault sometimes, when we talk about disaster preparedness and disaster planning, it almost suggests to our people that there's a disaster coming. And the first thing you hear is, God forbid, God will never allow that to happen to us. I also enjoyed the clip you presented earlier about President Obama making the prediction and asking that we invest wisely in disaster preparedness. So can you talk to us a little bit about how you would mitigate that, or how you would address folks who say, God will not let a disaster happen in Nigeria, so that then does not become our priority? How do you challenge that thought process?
I think education plays a part in a lot of things that we do, and we also have to kind of differentiate the religion from activities that are going on, it's real that COVID is real. We've seen the impact of COVID by us just saying that, oh, God, we pray that it doesn't happen. That's our prayers. But we know that disasters or pandemics are inevitable because of our climate change, because of so many other things that we also have been, we've caused by ourselves. And I think educating the religious leaders, we start from there, because they have like a great deal of impact to play when it comes to their members. And I think, especially in Nigeria, I've heard of churches that are over like 40,000 capacity. So what if something happens in such facilities? What will happen? What would they do? So to be prepared, in fact, even in the Bible tells us that we have to be prepared. So we need to take or think about course directions. We discussed about redirecting our thoughts, redirecting on how we think, or that doesn't mean that we're not religious. What it means is that even if I'm not, I'm protecting myself, I have to think not just about myself, I have to think about people that are next to me or within my vicinity that I could expose, and when their exposures could lead to their death. Part of the religions, when we're thinking about religion, is to love our neighbors as ourselves. So when I'm thinking about myself only, I'm not thinking about my neighbor in that perspective, because I could have the money or the fund to take care of myself and attend the best medical facilities, but my neighbor may not have that. So when this is kind of rethinking about the whole process, and that was what I brought about, reflecting on our previous experiences, our previous connections, and then thinking of how we can improve it, loving our neighbors as ourselves. It's not just about my religion, it's about every single person. Thank you. Does that answer your question?
Absolutely. Absolutely. Thank you very much. It answered my question. If there are other questions, please post them in the chat. Also recognizing one of our sponsors, Ms. Kenny Akintade, thank you for being here. Dr. Adejumo, so you presented a lot of information, and another challenge for us in Nigeria is whenever we look at the global space, it's very difficult for us to connect that with Nigeria. So what are some disasters that we should consider may be possible in a place like Nigeria? Because if we think about hurricanes, we're not coastal, so maybe that won't happen. If we think about earthquakes, so sometimes we remove ourselves from some of the potential disasters that could occur. So what are some disasters that have happened in the past, and some that you know, we may have been fortunate not to have experienced, but that could happen in Nigeria?
Yes, thank you. So I think flooding is a big issue because we just, in fact, not recently, was it last week? I read, I heard on the news that, like Lagos State, like even probably like 22 states in Nigeria had flooding issues, that people were displaced from their homes, cars were destroyed. Then we've had Ebola in Nigeria. We've had SARS in Nigeria. We've had many episodes of building collapses in Nigeria. We've had, well, what is it called? The current issues with terrorism. I mean, they're not calling it terrorism, but it is actually terrorism in Nigeria, that is still up until now. So perhaps Dr. Adejumo can help me with, those are the ones I can remember right now. Dr. Adejumo, can you assist with what you've seen, what you saw, because you're in the front line? Can I defer the question to you?
Yes. Let me hear the question again.
Dr. Prof, can you say your question again?
What types of disasters can we anticipate when we think about Nigeria in terms of planning? What types of disasters have we experienced, and what should we be planning for?
Yes, the one we're even experiencing now, because we now have it in about 30 states of the 36 states in Nigeria, is flood. So flooding is one of the major disasters we have been experiencing, and then that one is actually zoomed to NEMA. NEMA is a National Emergency Management Authority. So there is a health sector part of it, which we actually managed, but the major disaster is being managed by NEMA. So NEMA actually budgets for it every year, and then they came up with a plan, which we are actually part of it. But most of the time, the communities where this fraud is actually occurring, they don't listen to government. For example, at the riverside along Benue now, people are still, putting structures along the riverside. So anytime there is rain, at least during the rainy season, it wipes the whole place away. So that's the reason why we still need to continue to talk to the traditional rulers. We need to talk to the opinion leaders and as well as the religious leaders, for them to really move away. I think we have a lot to do in terms of flood. Flood is the major one. Collapse, that is collapsing of the building has been occurring for some time, but it's not as a big or as serious as flooding, which is a natural disaster. Thank you very much.
Thank you. Thank you, sir. Thank you.
Wonderful, Dr. Adejumo. All right, so a last question here, except if we have other questions in the chat. Can you leave us with, probably just 3 action items then? If we don't remember anything else from this presentation, what are 3 things we should take away? Let me also acknowledge some of our collaborators from the UK. Mrs. Keme Alfonso, it's nice to have you here. So can you leave us with 3 action items, or just 3 things we can take away from your presentation?
Yeah, so the first one that I think the action plan, if we have the nursing educators or medical educators here, I think we need to start from the nursing schools. About 2 years ago, the National Academy of Medicine in the US had a presentation about starting community enhancing or promoting community activities for nursing students. When disaster comes, it's not the best time to be drilled and to have the drills. When disaster comes, it's not the best time to learn the first act of how to intervene. And I think in the nursing programs, we've actually neglected nursing students from learning from other either medical students, learning together, or even the responders learning together, practicing together is the first level I think the educators should take. Now, when it comes to the community, we are the communities when they're talking about communities. Most of these disaster events, we see plastics everywhere on the floor, we trash our neighborhoods. We have to keep the neighborhood clean. Especially when it comes to the flooding, the gutters are filled with junks. And, when that, I believe that we, individual, every single one of us, we have a part to play when it comes to the areas where we live, when it comes to the areas in our neighborhoods, when it comes to even anywhere that we have, we live, right? We have to keep those places clean so that when there's time, like raining season, we shouldn't be scared that we're having rain or we're expecting rain. But we know the fact that when it rains in Lagos State, many houses are destroyed, because the gutters are overfilled, many places, many people are displaced, many vehicles are destroyed. Then the last thing that we need to put in perspective is learning, more about the disaster and, making ourselves available to volunteer. We don't necessarily have to get paid for everything we do. Volunteering in maybe the emergency departments, in areas where we live, getting to know what are the emergency responses or in those areas. How do they respond to emergency health services? How do they respond to fire? If I call like fire, if I need like a truck or fire truck, is it well equipped? We cannot just wait until that happens before I start thinking or asking or trying to find out where things are in my neighborhood. So those are the three things that comes to mind when I'm thinking about what we can do to help.
All right, thank you so very much, Dr. Adejumo. It's been an exciting time, and to all our board members, to our sponsors, and to our friends and well-wishers, we say a very big thank you. And without wasting time, I think it's high time we called it a day.
Thank you so much for inviting me too.
Thank you so very much.
Thanks everyone for coming.
All right, thank you everyone.
Thank you,
Do enjoy the rest of your day.
Thank you.
All right, thank you everyone.
Thank you so much, Ma. Thank you.